primarily with students that are interested in the business and allied health programs. So today I'm going to talk to you about the allied health programs here at CVCC and give you an overview of important skills you need for any of the allied health programs that you may decide to go into or be interested in, and the steps that you will take to apply and be accepted into those programs. So what are allied health professionals? Well, the Association of Schools of Allied Health Professions defines allied health professionals as a segment of the workforce that delivers services involving the identification, evaluation, and prevention of diseases, disorders, dietary and nutrition services, and rehabilitation and health systems management. Allied health professionals work in teams. They provide a range of diagnostic, technical, and support services that are critical to other health professionals they work with and the patients that they serve. Allied health professionals make up about 60% of the healthcare workforce. They work collaboratively with physicians, nurses, pharmacists, to provide comprehensive patient-centered care. So could you all maybe give me some examples of allied health professions, just off the top of your head? So
nurses.
Nurses. Paramedics. Yep. Yep. Any others? Radiologists. Yep. Exactly. Others include occupational therapists, diagnostic medical sonographers, respiratory therapists, and medical laboratory technologists. What's unique about allied health professions is that there are two different groups of professions. Some professions fall under the umbrella of direct patient care, and others fall under the umbrella of indirect patient care. So an example of direct patient care allied health professions would be respiratory therapy or radiology. Radiology is actually a radiologic technologist positions patients to prepare them for x-rays. They might administer oral contrast. So those are direct patient care examples. And they're indirect patient professions, such as medical laboratory technology. So not as much patient care. They're working more in a lab clinical setting. So what skills do you need for the allied health professions? There are three important skills: technical skills, communication skills, and leadership skills. Technical skills are hands-on skills, and those are necessary in both direct and indirect patient care professions. Examples of patient care fields and some of the technical skills that you need would be, for example, in respiratory therapy. You monitor responses to therapy that are administered, such as vital signs and arterial blood gases. Paramedics operate machines. They do EKGs. They have external defibrillators or bag valve masks that they use. In professions that are not direct patient care, for example, medical coding, you would be transcribing or coding procedures to make sure that the insurance company is billed correctly. Pharmacy technicians assist the pharmacist, but they're still using their hands. They're still preparing documents or transferring medication from different locations. So whether it's direct patient care or indirect patient care, you still have technical skills with them. The next set of important skills is communication skills. Verbal and written communication skills are critical in the field of allied health. In direct patient care professions, you're going to need to think quickly, and you're going to need to be accurate and communicate your evaluations and recommended treatments for your patients. You'll also need to communicate this information to your team in written form. So not only will you have to speak verbally and be sure to be accurate in what you're saying to the people you're working with, but you're also going to need to be able to write that clearly and concisely. And then you'll also need to explain procedures to your patients. So you might have patients that are scared, that are in pain. You need to be able to communicate clearly and effectively to them what's happening and what the next procedure will be for them. So a suggestion I have for you now, if you're thinking about applying to medical programs, is to think about in your classes, if you're taking classes now, perhaps you've had to work on a group project with people, or you're in a lab and you've had to communicate with other team members. Think about that and how that translates to the field of allied health or whatever medical profession you're thinking about going into. The next important skill set is leadership skills. And as an allied health professional, you're an important part of the healthcare team for your patient. So teams have certain characteristics. You interact together to achieve a common goal. So your common goal would be your patient's care. You make decisions together. You're going to be communicating your assessment of the patient with other professionals to ensure that the patient is treated appropriately. You're also going to sometimes find yourself needing to take a leadership role. You will be part of a team, and in some situations you might be instructing other healthcare professionals on what to do. So you need to keep that in mind as you treat your patient. Medical teams are interdependent on each other, and the more efficient the team, the more effective the care for the patient. So what types of, well, let me back up a little bit. Now I'm going to talk about the programs that CVCC has to offer. We offer a variety of allied health programs here. We offer Associate of Applied Science degrees, and then we also offer Career Studies certificates. So there are two different types that we offer. The ones that are starred are selective admissions. And some of them are direct patient care, and some of them are indirect patient care. So for the most part, they're all patient care, direct patient care, except for the medical coding, the pharmacy technology is also an indirect patient care program. So I collected some videos, so I don't know if maybe you want to share what programs you're interested in pursuing. These are all from career1stop.org, so they're short little blurbs on different fields if you're interested in taking a look at one, or if not. But this is a resource that we can look at. They're just like about a minute each, so I don't know if you want to check one out. If there's a program in particular that'll match you. Okay.
Dental hygienists provide preventive and corrective dental care and promote good oral hygiene and health. A typical day involves examining patients' teeth and gums for disease and cavities, cleaning and polishing teeth, and helping patients understand proper brushing and flossing techniques. To be successful in this profession, you must be detail-oriented and have the ability to work well with your hands. In addition, you must be willing to work with x-rays, needles, and anesthetics, following strict safety procedures at all times. This career has many enjoyable aspects, one of which is constant interaction with many different people from all walks of life. Other benefits include flexible scheduling and little overtime, making this profession an accommodating and pleasant one for many job seekers.
Researching careers, there are lots of good resources out there. Career1stop.org is one of them, as well as the Occupational Outlook Handbook. So I always encourage students to check those out. You can look at videos like I just showed you. You can learn more about the projected job growth for fields. You can even narrow down, with Career1Stop, you can narrow it down to this specific area, either here in Lynchburg or wherever you might be living, to see what the job growth is for that area and the earning potential. So, some resources for you.
How do you get to
onestop.org. Yeah.
It's spelled out. And with letters?
Yes, spelled out with letters. Okay. So now I'm going to talk about the steps to go into one of the allied health programs here at CVCC. The first is that we have to verify prerequisites have been met both in high school and in college. We have to complete a referral for the associate degree programs by the respective deadlines, and then complete an application and interview with the program director. I've listed the high school prerequisites for the various programs that we have here at CVCC. As you can see, they're a combination of English and math. Some require a lab science, so lab science in high school would be biology, chemistry, or physics. And they vary for the different programs. And all of this is listed on our website and also in our catalog for you to review. And I encourage you to look at our catalog because a number of our website, because a number of our programs have pretty in-depth information about their programs and applying and what is expected of you once you're in the program. So I encourage you to look at that. The college prerequisites, all of our allied health programs require the Virginia placement test for math and English. You may not need to take the placement test if you have college transfer work already this year or higher. So that's why you want to come in and meet with the counselor so we can review that and see if you need to take the placement test if you have college coursework. All require placement into English 111, College Comp. All programs require that you pass Unit 0 through 3 on the math placement test, with the exception of respiratory therapy, and they require passing all 5 units on the math placement test. Essentially, the programs want to make sure that you have working knowledge of algebra. They find that that's what students need to, the level they need to be proficient at to be successful in the program. The GPA requirement for radiology and respiratory is 2.5, and all others is 2.0, and that's college coursework. The next step is to complete a referral, and you do a referral with a counselor. You meet with the counselor after you've taken the placement test, and once we have your transcripts, high school and college, on file, you'll come in with the counselor by the deadline dates, and those are listed there. So we just passed the deadline date for the radiologic technology program. We're still accepting applications for EMS and respiratory therapy. And then medical laboratory technology, there's no official deadline for that program, so you can apply once you met the prerequisites.
The referral is what, like an okay from somebody from the counselor?
Yes, good question. So the counselors have the referral paperwork. So you will come in and meet with them, you sit down, we review your high school transcripts, your placement test scores, college transcripts, and the counselor fills out the referral and then sends that to the program director along with all your transcripts. Yeah, so it's something you do with the counselor. Once the program director has received the referral, that prompts them to mail you an application. And the applications are mailed directly to you. Usually with the application is a cover letter explaining how long you have to get the material back to the program director. Some programs require you to get letters of recommendation or references, others do not. And the applications ask questions, of your interest in the program, and they want, thoughtful and detailed answers and responses to the questions. And then the next step is an interview. And the interviews vary depending on the program. The programs that have individual interviews are respiratory, paramedic, and medical laboratory technology. Radiology is a little bit different. They require a group interview and then also an individual interview. So that's a little bit different. Most of the programs have you invite you in for a clinical tour, so you'll actually go and see the clinical site that you'll be going to as part of the clinical component of your program. And then the radiology program also requires students to take the HESI test. And they require the reading portion of the HESI test and the math portion. So just two components to that test that you have to take.
Is that after the exam?
I'm not sure exactly.
But it's some sort of place.
Yes, yeah. It's done for a lot of allied health programs and nursing programs sometimes require it. It's a health program entrance test.
So does it come from like alliedhealth.org or something like that?
I'm not sure. I'll have to
Health Education Systems Incorporated.
Thank you. Very good, very good. Thank you.
And I just guessed that.
Yeah, that sounds good. That sounds
Thank you.
Close enough. No, it's right. I looked it up.
Sounds good. And then acceptance into the program. So after you've gone through those steps, you find out in May whether you've been accepted or not to the program. You'll have an orientation over the summer where you come on campus, you meet with other students that have been accepted into the program. We register you for your classes, and then you start the program in the fall. All of our allied health programs start in the fall semester, and they accept once a year.
So if we like took biology in high school, that's good.
Yeah,
And that's like 25 years.
right. No, there's no time.
So I'll admit, I was not the best student in high school. So like a C in high school, my way of thinking right now is like, I'm gonna take it over and put it over here. That would be just like a waste of time.
Well, I don't think so. I mean, I think it would be helpful to help you refresh on the material. And so, as I said, and it just, it also depends on what program you're looking to go into, what the requirements are. So that's why it's good to come and sit down with the counselor. If you can have your high school transcripts with you, that's wonderful. Or if they're on file, I hope we can look at those and see what you've taken and kind of devise a plan as far as your application.
The catalog lists the courses that are required for each program. So look at the catalog for what you're interested in. You have to take anatomy, physiology 1 and 2. You'll get your biology.
Yeah.
Words that don't really.
Well, I'm thinking like, should I take biology so I'll do better in those? But maybe, I don't know.
Maybe.
That's a good question. And some students do that. They feel like if they look at the course description and they feel like, you know what, I'd like a little bit of a refresher, they might retake general biology.
Because I know hygiene seems to be very competitive. So, like GPA is going to be
Yeah, GPA is
huge.
is important. And depending on the dental hygiene program, it might be different GPA requirements.
Taking 18 a year, it's not many.
Yeah, you have a choice. I don't know anything about the dental hygiene, that's why you talk to her, but as far as the science classes, like you take I don't know if it's required for the program, but if you take like the health nutrition class, then that, if you haven't gone and you haven't been in high school for a while, it's a good review because they go through all the systems, okay? And so that makes biology and your anatomy class easier. But then on the other hand, since we have taken anatomy here,
Yeah, there's a class called
medical terminology.
Medical terminology.
It's something I'm sorry, I absolutely think you gotta take because
I'm
they're
in
gonna
that
get.
now. I think you're in that.
Yeah, you gotta take that before you take anatomy, or you're just going, and I'm not saying you have to take the 3-unit one, you only need to take the 3-unit one if you're going into coding. But if you take that 2-unit, you are going to be in a much better position. And of course, the nutrition class, which is like needed for nursing and things like that. So you've already knocked off one thing, and at the other thing, if you haven't been to school and done biology for a while, then basically that nutrition task does a really good job of going through all the systems at a very high level. So that at least
and the digestive system at a detailed level.
Yes, yeah.
So like, yeah, I'm in
You're
a class,
taking it now?
Yeah, I'm taking a class right now. It's nutrition and human development, and it's required. It's like a required prerequisite for, you know, if you plan to go on and go into nursing or go on to a 4-year school, get a BSRN. I mean, that's one of the prerequisites is nutrition.
And they have excellent teachers here. I took it to a different teacher. I mean, seriously, they do a good job, and so you can do that. Now, if you look and you know, like you want to go like into nursing or like a physician assistant or whatever, then you have choices, because this school here has a great advantage in that they, you guys, if you look at the prerequisites closely in the catalog and not in the schedule, because the catalog always overrides the schedule, then you can see that you can take your anatomy and it'll override your biology requirements, like if you want to take, you know, microbiology or something like that. So, yeah, you really need to look at your catalog and say, this is the path I can take, and this is the safest for me, because either A, I mean, some of the high school students, they'll zip through anatomy, and then some of the high school students, they have anatomy in there, you know, already. In fact, my son took anatomy, and when I was taking anatomy, and his whole anatomy class was exactly the same level as it was here from Jefferson Forest. So, you know, everyone has to make their choices of how long it's been since they took biology, and what their background is, you know. But I'll tell you, I'm on anatomy, let's take medical terminology class.
Medical terminology.
Absolutely, yeah. I'm actually an advocate for requiring it. Changing the class, seriously. Because it's like, you're just going to die memorizing all that stuff.
Yeah, it'll teach you the Latin medical terminology.
So you just look at the word and you won't have to memorize the word. You'll go, oh, I know what this is. So when they're doing the matching, you go, oh, even if you can't remember, you can go, oh, this has to be this one over here, because here's the prefix and here's, you know, yeah. So it's really important.
And you're in that now?
I am. Which I'm enjoying it. Are you enjoying it? Is it a 3-unit?
Like
Jane
solving puzzles,
Yeah.
more than remembering things and memorizing things. So it's really useful. And I have my book if you would like to take a look at it.
And if it's, yeah, but it's the 3 units, then you need that for your coding. You absolutely have to take the harder one, the more encompassing one.
Is the 3-unit course required for coding?
It's required for radiology.
Yeah.
And the other thing is, like, if you go, I'll take the 3-unit and then I'll use that for my nursing. If you take the 3-unit first semester, you have to take the second 3 units to get into your nursing. They require both 3s versus or just the first 2, because they're different courses. The 2-unit actually will focus on what you need for nursing, and the 3 units going over the whole thing, what you need as a coder. So just passing on what we. But she can go over your, you know, but that's basically, if you look at the units, figure out what you need. So, even your physician assistant, they're, except for Shenandoah, will require all 2 units. So, and then some of your nursing programs and some of your physician assistants, you'll go to a site and it'll say, I want to accept this course if you haven't taken it in 5 years. And then you go to the other one, you assume it's the same way. Like if you apply to like Shenandoah, they don't have that 5-year requirement.
Every school is different.
So just because this one over here says you gotta do it within 5 years, you know, I talked and they said, oh no, if you took that in biology in high school, we don't care if it was so many years.
Chemistry 45 years ago, that's okay with us. Yeah.
It's true. She said that. She goes, yeah, it's true. So you can't just say, oh, I need that 5-year limit. It's not true of all the schools you got to shop around.
Medical coding.
So medical coding would be coding medical procedures that you've had done so that the insurance company is billed correctly. So you would work in an office or a hospital in
like
an administrative. There are no accounting classes in that program. It's more learning, you know, for this procedure, this is the code to put into the system so that insurance companies are. So not a lot of patient hands-on interaction with medical coding.
But if you like at the Centra, they have positions there where they require that this. But how long is the coding take? 2 years here. Okay. So let's say you want to become an analyst. You're required this 2-year thing, so you go on for your 4-year degree with processing or whatever, and they're making like $80K over here at Centra. But you've got to go and you've got to have that coding background. So you could go over to, you know, a university and transfer over and become a processing or quality person, and then get a job at the hospitals, and they're all looking for somebody that will look and be able to look into the medical records, you see, and they're making more than the nurses.
The coders?
Not the coders, the quality process engineers. It's a new job that came up in the last, 5 years.
I haven't heard of that.
So it's at every one of the hospitals now, because they have to do quality measurements for their health care along the way and improve it. So it's a good profession. Get into it, and you need to have that coding background. You cannot get it. You cannot get that job without having the coding background.
My fear is being home with my kids for 20 years, and now I'm going back and haven't had that experience or foot in the door in a dental office or anywhere. It's like, she's going to be in here 48 years old.
Well,
No experience.
That's you want to think about that is maybe reaching out to your dentist and seeing if you can volunteer or shadow, and get some experience into the field.
Because I'm so willing. I don't, not to be negative, but if, you're not accepted that first year, I'll definitely keep trying to in.
Yeah.
But maybe even just assistant.
Absolutely. Yeah. A lot of dentists will train assistants on the job. So that's something to think about.
Just like it says radiology, doing radiology.
I'm sorry.
You'll have to have the radiology work assistant, I think, right? I know they do x-rays, so I'm thinking,
I'm sorry.
if being an assistant,
In dental hygiene.
Right.
Yeah, assistant.
assistants don't have that.
Yeah, so the assistant, would assist the dentist as he's doing the filling.
And I know they do the x-rays, so it's the radiology part of it.
Yeah, okay. I think that's, dental hygienist would do the x-ray. Hygienist would do that.
Well, not to, this past Friday, I just had some tooth work done. And because I even chatted with her, we were talking about school and all, and she said she was the assistant. She didn't do the x-ray.
Oh, did she? Okay. Maybe she had certification.
Yeah, I guess that would make a difference. Maybe not the hygiene, but she had. Yeah. So there are levels.
I'm in the counseling office, if any of you want to come and sit down with me. We start registering for spring classes April 13th, fall classes April 13th.
Summer's already open.
And summer is already open, so if you want to take any summer classes,